Okay, we're right at 9:30, so we're going to go ahead and get started. So our opening plenary speaker is Miss Greta Brown. Miss Brown is a native South Carolinian and a graduate of the University of South Carolina. Miss Brown joined the Alzheimer's Association in 2020 as the Manager of Programs and Education with oversight of all care and support initiatives throughout the 21 counties that comprise West Tennessee. Ms. Brown was appointed to the National Research Champion Division of the Association in 2021 and served as one of two research representatives for the region comprising Tennessee, Alabama, Louisiana, and Mississippi. In August of 2022, Ms. Brown was promoted to a national role with the Alzheimer's Association and began serving as the Senior Associate Director of Community Engagement. She is charged with oversight and support of community education and support outreach across 17 states. Ms. Brown's presentation is entitled Enhancing Outreach and Community Impact Through Alzheimer's Registry Data. Please join me in welcoming Ms. Brown.
Well, good morning. Thank you so very much, Dr. Ingram. I am incredibly honored to be with you this morning and would like to extend my sincere thank you to Dr. Lucy Ingram and the entire staff of the Arnold School of Public Health at the University of South Carolina and all those responsible for coordinating this conference and for allowing me the opportunity to be a part of this year's conference, and particularly among such an esteemed panel of speakers. So this morning, I would like to begin. Let's see. There you go. Sorry about that. I would like to begin by sharing a little about the Alzheimer's Association. So formed in 1980, the Alzheimer's Association is the leading voluntary health organization in Alzheimer's care, support, and research. Our mission is to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Everything that we do, care and support, advocacy, research, is evidence-based, meaning it is rooted in the most up-to-date research. We are recognized by the global scientific community for our unwavering focus on helping people living with dementia and their families every day. And that's exactly what I want to be able to talk about and share with you today. So I'd like to begin by taking a look and exploring how registry and research data can be used to create meaningful and impactful community engagement. Dr. Fredrickson just shared some amazing statistics with us. And I think those statistics highlight exactly why it's so important for us to make sure that we are in communities and connecting with communities and sharing what we're learning. And registry data, I believe, really empowers us to do that. So there are three things I feel that registry data does. It educates us, most definitely, in the fact that it tells us who's being impacted based on ethnicity, sex, geographic location, economic status, and health status. And then that information guides our responses. It basically tells us what kinds of services that we need to be providing in communities, what kind of additional research studies need to be conducted. And then most definitely, it guides us in terms of showing us what groups of people or particular demographics we need to make sure are at the center of our work and our efforts in communities. And then the third thing that I feel that registry data does is that it influences our behaviors. This data can highlight a need to establish collaborative partnerships, which we're definitely going to talk about a little bit today. And then those partnerships, remembering that they can be with groups, organizations, community members, and we're definitely going to look at that, and leaders, all those people in the community who have the ability to connect us with those specific groups that have been identified by the data as having the greatest disease burden. So while all of the data collected from ADRD registries is certainly crucial in the work that we do in the science, in making scientific advances. I think that we are equally as responsible for using this data to make sure that we're dedicating our energy and our time towards supporting families being impacted by ADRD. It's imperative that we take what we learn from the data and make it work, make that data work in communities and not just be about communities. So we have all of this powerful information. Now what? How do we make practical, everyday differences in the lives of those people who are on this very difficult journey? And as Dr. Fredrickson said, maybe this is a little bit of a bragging session, but I'm very excited to share with you today the Alzheimer's Association's response. I believe that first and foremost, the outreach response to registry data and research data, it should be centered around providing ongoing support and services to all of those being impacted by the disease. Last year, you had a very dynamic speaker, Dr. Roland Thorpe from Johns Hopkins, and he reminded us that it's very important that we not have this helicopter approach where we're zooming into a community, we're getting the data and the information that we need, and then we're out. And so what we are trying to do at the Alzheimer's Association is to make sure that we are establishing, that we are responding in a way that is ongoing, and that those resources and the support that we establish in communities, that it lasts. And it is, again, as I said, practical, everyday kinds of resources. So this morning, I want to take a look at 5 responses to the data or to data that have allowed the Alzheimer's Association to really enhance community outreach. So at the top of this list here, you'll see creating support resources, providing consumer education. And I want to say about creating the support resources, again, practical resources that do exactly what I mentioned earlier, making a difference in the everyday lives of those being impacted by the disease. Then when we look at providing consumer education, we want to provide education that really empowers individuals to make a difference in their own health outcome. Our third response, establishing collaborative partnerships, partnerships which truly impact the amount of people that we're able to reach. Increasing awareness. This is so important. The increasing awareness includes sharing updates in research, sharing with people how to get involved, talking more about the disease. And I do believe that this is the one area that is crucial to our bringing this disease out of the shadows of secrecy. One of the things that we often talk about, and we hear even in the community members admitting that ADRD is Alzheimer's disease and other related dementias. It's just something that people seem to not want to share and talk about. And when it happens to a family member, we want to keep it behind closed doors. And so I think as we continue to increase awareness, we will certainly be encouraging people to step out of the darkness and to bring the disease out of the shadows. And then our 5th response that I want to share with you is conducting studies and clinical trials. And I think this is important because we have to do this in order to discover possible answers and solutions to reducing risk, as Dr. Fredrickson said earlier, increasing early detection and prevention, and of course, developing therapies that slow the progression and eventually a cure for the disease. So we're going to look at these in depth. The first one that we're going to look at is support resources. I believe that the Alzheimer's Association has truly developed some extraordinary support resources. And at the top of that list is our 24/7 helpline. So this 24/7 helpline operates 365 days a year. It is never closed. Even during the holidays, it rotates Christmas, Thanksgiving. So all year long, this contact center is manned by master's level clinicians and specialists who offer confidential support and information about the disease to people living with the disease, their caregivers, family members, and the general public. So whether you're wanting to you have a disease question, you have a question about the disease, or it's 2 o'clock in the morning and you're dealing with an issue and you don't know quite how to handle it, this is the number that you call. And that number is 1-800-272-3900. And I want to point out, as I go through this list, I think a number of these resources also, I think, address the issue of families often feeling like they are alone when they're going through this journey. And I think that a number of these resources provide the opportunity for families to feel that they are not alone, that there are people that they can reach out to, that there are people that they can talk to. Then we look at our early stage engagement. These are basically activities that we develop in cooperation or in partnership with organizations in the community. And they are designed for those who might be in the early stages of the disease. And so the idea is, number one, for people to still be socially connected, but two, also to keep them busy and active. And these are not necessarily activities that the association designs, but activities that are designed, as I said, in connection with, we're working with community organizations to create meaningful activities. So I like the idea that these are activities that the community and the members of the community are saying would be good. Then we have our support groups. Now, the Alzheimer's Association support groups provide emotional, educational, and social support. And I think one of the important things to note about our support groups is that when COVID hit, they actually had to go virtual. But that wound up being somewhat of a lesson for us. So they remain virtual. So these support groups now operate in person and virtually. And the advantage to having a virtual support group is that when there is a need for a particular kind of support group that may not be in existence in the area that someone lives in, they're actually able to join another support group in another state even. Here in Tennessee, and I am in Memphis. And so we had a situation here in Memphis where we had a couple where the husband had developed younger onset and the wife was looking for a younger onset support group. She didn't want just to be in a support group. One of the things that she said, and I thought that it was very poignant, was, Greta, I still have a mortgage. I still go to work every day. I want to be in a support group of people who are in my situation. And so because we did not have that kind of support group established yet in Memphis, and this goes back to, again, people bringing the disease out of the shadow, we have to acknowledge what's going on so that resources and support groups can be created. But we just did not have enough people coming forward saying, hey, this is happening in our household here. And so what we did was we wound up putting her in a support group. We connected her with a support group in another state. And she said that it was wonderful, she found it to be extremely beneficial. So we believe that support groups are one of the most valuable support resources that we offer. And then we have our annual caregiver conference. Again, when the data shows us that there are 11 million caregivers in the United States. So when Dr. Fredrickson mentioned that there are over 6 million people living with the disease, there are double as many people providing care for those people. When we know that, We also know, I want to also say this, and I think this is extremely important. Those 11 million people provide 18 billion hours of care. We want to support and equip these dedicated caregivers with resources. Caregiver conferences, they bring multiple service providers together. It's not just the Alzheimer's Association talking about resources. We are bringing in those people who actually provide services to the community so that they can talk and share the details of the services that they provide and how caregivers can connect with those services. And one of the things that I also want to point out is that oftentimes in a caregiver conference, one of the things that we learn is that a number of those services tend to be underutilized. Service providers are coming and talking about what they're offering, and families sometimes have not heard or don't know the extent. I've heard about this service, but I didn't know that you could do all of that. So I think then the other thing that we need to also focus on in caregiver conferences, and we do, is not only encouraging caregivers with best practices for great caregiving, but we also highlight the importance of caregiver self-care and wellness. And in the state of South Carolina, you have 216,000 caregivers. The data shows that 60% of those caregivers are actually living with chronic health conditions of their own. And I think that caregiver conferences, I look at them as a resource because they do something in some sense that even support groups don't do. Support groups are kind of peer-to-peer, whereas in a caregiver conference really allows you to be connected with those professional services that will help you in your journey. The next resource that we have created is the Community Resource Finder. And I think that this is probably one of the most useful tools that we've created. This Community Resource Finder, which you can find at communityresourcefinder.org, is basically an online, it's an electronic directory of resources. So you would log on to this site, type in your zip code, and then it has options for all different kinds of services. So everything from day services to in-home services. I'm looking for a neurologist or a geriatrician. You select the service type that you're looking for, and it then connects you with a list of providers within a certain geographic area based on your zip code. So within a certain mile radius of your zip code. I think that it is perhaps, again, one of probably the most underutilized resources. And that is exactly why it's so important for us to be in community and sharing all of this information. The next resource that we created was All's Connected. Now, this goes back to what I was saying about creating opportunities to bring people together so that they don't feel so alone in the journey. And All's Connected, is basically a free online community where everyone who's being impacted by the disease can come together and talk. So whether you're living with the disease, whether you're caring for someone, you're a family member, you're a friend, or that you've lost someone to the disease. So this allows individuals to come together and share experiences and talk to support one another. The last resource here is the All's Navigator. A lot of times what we hear is when a diagnosis occurs, people don't know what to do. I didn't know what to do first. This particular tool is basically a planning tool. So you would give it some basic information, you log on, you give it information, tell the system what you're looking to do. I'm looking for, help to planning for the future, working with doctors, caregiver support. And based on the information that you give this system, it then creates a personalized action plan for you. All right, now we're going to look at our second response, providing education. As we look at the number of people being impacted by Alzheimer's disease currently. So when Dr. Fridrickson said, again, a little over 6 million, what we need to remember is that that number is expected to double by the year 2050. And the Alzheimer's Association provides care and support to those affected by Alzheimer's and all other dementia through free, high-quality education programs that focus on Alzheimer's disease, caregiving, and communication. I think that these programs are extremely important as we are anticipating that number to double. So when we look at education programs like the 10 warning signs, and I've given you just a small sample of those programs here, the 10 warning signs, healthy living for brain and body, effective communication, dementia conversations, managing money. And now we even have a session or a program on the latest updates in research. The great leader Nelson Mandela reminded us that education can change the world. And when we look at some of these particular programs, we really see the opportunity to do just that. The Lancet Commission report on dementia stated that up to 40% of dementia cases could potentially be prevented or delayed by targeting some modifiable risk factors. So things such as physical activity, diet, social stimulation, and all of those things, and that concept is actually covered in our Healthy Living for Brain and Body class. And so when we look at how making lifestyle changes could actually impact the development of ADRD, that's information that we absolutely need to have in community. It's great that we know it, but we have to pass that information on. I also wanted you to take a look at the 10 warning signs. I think that this particular education program, not only does it highlight or help us to understand the difference between normal aging or signs of normal aging and then the signs of perhaps Alzheimer's disease, but I think it lends to increasing early detection. And early detection is important because when we know early on, it allows us to understand our symptoms. It helps us to perhaps improve health outcomes. One of the biggest things that early detection would enable us to do is or an early diagnosis even would be to be a part of our planning. So a part of making legal and financial decisions, a part of deciding how certain things will be conducted or how you want to plan, and not waiting until to a point where you can't be involved in the plan and others are planning for you. I think also managing money it's actually a new class for us. This is a powerful class that talks and covers on topics like how caregiving affects finances. It looks at discussing legal and financial documents that caregivers need to have in place. And then it also looks at creating a backup plan, because sometimes we may have plans of how we're going to care for a person, a loved one, and then something happens and we're not able to do that. And so it's so important to have a backup plan. Again, all of these are education programs that are based on the everyday needs or everyday experiences and needs of those being impacted by ADRD. To give you an idea of the power of these programs, we once had an attendee to send us an email, and she actually had attended the latest updates in research. And she said to us, "I have never felt so empowered as I felt at the end of that presentation." And that is exactly what we want people to feel. We want families to feel empowered to control their own health outcomes. Our 75 chapters are providing these education programs in communities all across the country. They're connecting with churches and community centers and libraries and universities. And there is also an opportunity to participate in these education classes virtually, as every chapter has a standing monthly calendar of virtual programs. And so you would simply connect with your local chapter to get to be put on their distribution list to receive that monthly calendar. Okay, well, we're having some technical difficulties here. So the next response is collaborating with communities. And I had this great graphic. I'm not quite sure what happened, but this is the graphic showed kind of, a bubble of one person, and then lines drawn where that person would then be connected with all these people, and then the people just kept connecting with other people. And I thought that it was such a powerful visual to show how important it is for us to really collaborate and not take on the burden of trying to reach everyone ourselves, because we realize that there are some powerful connectors and influential people in the community who can help us to do that. One of the greatest collaborative partnerships that we have at the Alzheimer's Association is actually with our volunteers. We are able to connect with thousands of families through the extraordinary work of our volunteers. And these volunteers work in roles as community educators, community representatives, public policy advocates, walk committee members. These dedicated volunteers are responsible not only for delivering the thousands of education programs, but also for creating walk events and helping us to raise awareness. And we're going to look at how walks can do that. And then also using their voice to create policy change that benefit all of the families on this journey. Our other collaborative partnerships are, of course, those based in the community. Some of these partnerships aid us in connecting to the community, and then others actually complement the services that we are already providing. The data tells us, again, who's being impacted the greatest or the most. And thus, what these groups do is that they help us to connect with those particular individuals. So as we know, African Americans and Latinos are at higher risk for ADRD. African Americans are 2 times more likely to develop the disease, and Latinos 1.5 times more likely to develop the disease. It's important to connect with civic organizations like sororities and fraternities, churches and nonprofits, veteran agencies, and others that provide connections to these high-risk groups. And then the data shows us sometimes that there's a prevalence in certain geographic areas. So when we look and we see that the prevalence is in a rural community, then we want to create partnerships with organizations like libraries. One of the things that I have said about libraries is that libraries are a place where everyone feels welcome. And so when we look at the fact that racism continues to be a barrier to health equity, being able to provide an education class, because clearly these education programs, they are allowing us to address health equity, right? Everyone has access to the education programs. And so if we come into a public library where everyone feels welcome, then everyone gets the education. So when I spoke to a group of library directors in West Tennessee, one of the things that I said was, when we looked at the people that we wanted to partner with, particularly in rural communities, the question was not why the library, it was why not the library? But here's the thing, in rural communities, we also need to consider, most importantly, the community members. I was thinking about a lesson that I received very early in life about the power of individuals and community members in community. So in an area not very far from the University of South Carolina, there was a lady who decided that everyone on her street needed to lose weight. And so one day she decided that she was going to have everyone stop eating off of dinner plates and move their food to breakfast plates. Now, this lady was my grandmother, and she lived in an area called Little Arthurtown. And I remember when she came up with this idea, I thought, now I didn't say this to her in this way, but I thought, now, why are they going to listen to you? Right? She has no medical background. She's not a dietitian. But I said to her, so Grandma, how are you going to get people to do this? And she said to me, I'm just going to tell them to do it. And you know what? Several months later, and several shedded pounds, clearly they listened. That is an incredible example of how people who live in the community have such influence and power. And if they have passion, they can actually inspire others to have passion. One of the things that we have done, kind of even based on that model, is that there are several chapters around the country within the association who have established advisory councils. So these advisory councils are comprised of community members in a particular demographic. So let's say we have an African American advisory council. So we find African American leaders, community members who have influence in the community, and we share this information with them. We share the data, and then we all work together to connect with community members. And these people are actually going into the community and opening doors for us so that all of what we're learning, because again, it's great to have this information and it's great that we're creating these resources, but if we aren't sharing them, then they're pointless. And so these kinds of collaborative partnerships really help us to be able to share with the community all that is available to them. I want to say also that I think one of the things that's really important to note is that, we realize that people who have history in the community are best equipped to teach us how to effectively connect with the community. And so one of the things that I think is really important to do is not just to allow people to help you get into the community, but allow them to teach you, allow them to tell you what to do, what not to do. We internally have a number of work groups within the association. And we've created a rural work group. And I recently invited a rural community member to our work group because I said to the group, we can talk about what we find in research and come up with ideas and plans for how to connect with rural communities. But the best way to learn how to connect with the rural community is to hear from the rural community. And her conversation with the group was so eye-opening. She told them, when you come the first time, don't come asking for anything. Don't even come offering anything. Just come and get to know us. And if you want to really get to know us, the biggest event happening in our little town is the football game on Friday night. And I thought that was so interesting. A lot of times we're always so focused on, well, I'm going to go in with my iPad and, we're going to have a meeting in the office. No, she said, come to the football game and let's talk. And again, you're not even collecting data. You're just coming to get to know the community. And from that, one of the things that she pointed out was that when you start to build those kinds of relationships and friendships in the community, then they can walk you into the places that you need to go. And so I think we definitely need to remember, as even Dr. Thorpe said last year, that there are experts in the community. We may be the experts on this on this side of things, but we need to view community members as experts in their space and allow them to teach us. Now, the last type of collaboration, I talked about collaborations that could also help to complement the services that we are providing into the community. And so when we do look at data and it shows us that there are so many people living with the disease, with ADRD, who are also living with comorbidities such as diabetes and hypertension and heart disease, then I think that that definitely, excuse me, it definitely leads to the opportunity for us to partner with health agencies like the Heart Association or the Diabetes Association, because our goal is always to equip families with valuable guidance, with as much valuable guidance as possible in all aspects of reducing risk and prevention. Oh, well, here, I apologize. It needed to populate. Here's my little, there's my slide. All right, but we're ready to move on to the next one. So in addition to the local partnerships that we create in communities, the association's DEI team has also established some national DEI partnerships. We believe that engaging diverse perspectives is critical to achieving health equity. I want to point out that a number of these groups and organizations also have local chapters within, cities. So this has actually helped us when the DEI team establishes national partnerships. It then helps us to connect more quickly with those local chapters. And so one of the organizations that I will point out here is the AME Church. We partnered with the AME Church over a year ago, and that partnership includes providing education programs to the AME members. It also includes recruiting AME members to become involved, because what we want is for AME members to become educated. We want their families to become educated, but we also want them to share the information. So as they're learning, we want them to love on their community. And in fact, that's what the church does, and share the information that they're learning. We have also hosted a number of Purple Sunday events, and those have actually been held virtually. And these are awareness events for the AME Church. The last one we held about 2 weeks ago, I believe, and there were 2,000 people on this call. This has been a phenomenal partnership. We also have a partnership with the Links, which is a professional group of African-American women who are dedicated to service. And so we are connecting with them, and so that they can then support our efforts to go out into the community and provide education programs to families across the country. Our third response, or fourth response, I should say, is awareness. So, in the beginning, when I mentioned awareness, I talked about how awareness, when we work to increase awareness, we really are working to bring this disease out of the darkness. The Alzheimer's Association is committed to the inclusion of all communities and the advancement of health equity through our conversation, work, and partnerships. It's vital that we listen to the experiences of the most affected by Alzheimer's and dementia to identify the needs and gaps. And so we do that in a community forum. Community forums are one of the most, I think, powerful awareness initiatives that we have, because in a forum, a couple of things are happening, right? They inform, they consult, and they involve. Inform, meaning that we are coming into a community forum, informing the community about the latest updates in research. We are talking about, resources that are available. We're talking about statistics. But the consult part comes in when the community members are consulting us, and they're telling us what they need, what kind of support services they would like. I think sometimes that we can be guilty of, and when I say we, meaning all of those who want to make an impact in the community, we can be guilty of taking data, making assessments, and just creating what we think needs to be placed in the community. But forums prevent that. They allow the community members to decide what services they need. And the thing that I love about a community forum is that it involves the entire community. It is not just a sitting down with a couple of people, a couple of community members. Let's say we sit down with a couple of community members and we hear what they think, what they're thinking, we hear what they need, but then there's no one in the room who can actually implement those ideas. So it's important that we have faith leaders at the table, that we have people from city council, that we have enough people in the room where we are getting the kinds of information that we need, and we're also empowered, or the community is then empowered to actually make change through those leaders that are in the space. I do think that it's important to note, though, we were with Dr. Damian Francis with Georgia College earlier this week, and he was reminding our group that it's so important, though, that when you create those kinds of events, that you're not overwhelming the space with leaders, because we always want the community members to feel that it is their space. So it's important to have the right kinds of leaders and just enough of them. The second avenue that we raise awareness is through our walks. Now, while most think of a walk as a huge fundraiser, and it is, it's also a huge awareness builder. Sometimes social events are wonderful opportunities to provide education and to just bring light to the disease. As an example, a walk helped us to reach nearly an entire small town in a rural area of Tennessee. Again, with the help of community members leading the way. So we had 2 people in the community, they spearheaded this, but I'm gonna tell you what they did. There's a little bit of a story behind this. There was a walk in an area called Jackson, Tennessee. That's the Alzheimer's Association walk. So we have an established walk in Jackson. But the members of this community said, our people are not going to drive that distance. And it was about an hour. So they created their own walk in their town of Halls. The first year, they had a nice turnout. But the second year, they turned their walk event into a block party. And half the town, I believe, showed up. It was the most impressive event, not just because, and I'll tell you, they raised $12,000. A town at this event, we were able to, from the stage, talk about why their steps in the walk was important. It wasn't just about raising dollars, it was about every step they took was a step pulling this disease out of the darkness and into the light. And into the light is where you find resources and support. In the light is where you find hope. I cannot tell you how impactful that event was. My understanding from the organizers of this walk block party is that people are already asking, okay, so when is it going to be this year? And that was last month in February. I think that walks have an incredible ability to raise awareness, and perhaps in a somewhat, I'm going to use the word lighthearted loosely, but in a lighthearted way, where it's not such a, we're all coming together. No one has to be embarrassed. I think that is so important. The third way that we raise awareness is through impacting public policy. And we need to remember that when we raise awareness, we need to include the entire community, particularly those in power, in positions of power and influence, to support and even fund the support that's needed. So I'm sorry, I'm going to have to, my bar is moving here. We look at, when we look at what our efforts, excuse me, I have so many things going on with my screen, I apologize. When we look at our efforts in public policy, effectively implementing Alzheimer's plans and supporting other policies, we feel will reduce the long-term impact of the disease and state budgets and improve the lives of individuals living with dementia. So we are working in public policy to increase access to care and support and treatment, improve quality of care, advance risk reduction and early detection and diagnosis, and ensure a coordinated statewide response to Alzheimer's disease. As an example, I wanted to say that I know my colleagues in the South Carolina chapter office right now are working to, under the direction of Taylor Wilson, they are advocating for an Alzheimer's disease research center so that you can focus on new treatments and disease prevention. And that is to benefit the entire community. And I think it's so important, to note that even when our volunteers, when I mentioned earlier that we have volunteers who volunteer in this way, the community needs to know that we are working to support them in so many ways. So even beyond just bringing resources to the community, beyond educating the community, we're working to also enlighten politicians and leaders in the space, because those are the people that can bring those kinds of resources, a research center. One of the examples also that I'll share happened here in Tennessee. Just last year, we passed the Colonel Thomas G. Bowden Memorial Act, and that act provides Tennesseans who are serving as caregivers with respite grants. So again, when we look at the number of families who are providing care, and that's another thing that comes, another kind of data that comes out of registries, we learn where certain pockets are where people are being cared for more heavily by family members than they are within some type of professional setting. And so we want to make sure that we are supporting those caregivers and providing them with as much support as possible. And we're all working to make that happen. Now, our last response is research studies. I want to really talk about the impact that research has on communities. So one, let me say this, as the world's largest nonprofit funder of Alzheimer's and dementia research, the Alzheimer's Association is committed to accelerating the global effort to eliminate Alzheimer's and other dementia. Our MedSci department has undertaken a multitude of diverse initiatives working toward methods of treatment, prevention, and ultimately a cure. So while today there are over 140 unique therapies being tested in clinical trials that target multiple aspects of Alzheimer's biology, and that's something that I think is so important for families to remember. When we talk about this disease being in the shadows and people somehow or another perhaps being ashamed of it, it's just a disease. This is a disease resulting from biological changes occurring in the brain. So while there are these therapies being tested that will address the aspects of Alzheimer's biology, I think it's important for families to understand that not all clinical trials are centered around drugs. Some are about lifestyle changes. So when I talked about the education program, Healthy Living for Brain and Body, and we talked about how making changes in diet and exercise, in sleep, how those can lend to perhaps preventing the disease. We have trials centered around those kinds of studies. And as we know, there is an understandable lack of trust, particularly in the African American community, I think it's important for people to know that they have options when it comes to being involved in studies. And so I wanted to point out this one study, the US Pointer. So currently we are leading a landmark clinical trial called US Pointer. This is a self-guided and structured intervention that looks at a multi-domain approach to risk reduction. I want to go back and highlight self-guided. This study involves incorporating physical activity, nutrition, intellectual engagement, so just social involvement, as well as health coaching as a part of the study design. We just reached our goal of 2,000 participants. And the interesting thing to note about these participants is that they're currently cognitively healthy. However, they may have some connection to being at high risk. So perhaps they have a primary relative, a mother, father, brother, sister that's living with the disease. And we are going to study them. You can see here, we will be studying their behaviors and to see what type of result comes out of this. So at the bottom of the screen, you'll see it says, if the interventions prove effective, this study will lead the way in the development of an accessible and sustainable community-based program for prevention. So I think this is certainly a very exciting study, and we cannot wait to get the results from the study. All right. So as there is, though, unlikely to be one single therapeutic that is going to be able to treat this disease most effectively, we will probably be treating Alzheimer's disease like we treat cancer, right? Or cardiovascular disease. It's going to be a combined approach of multiple powerful, effective therapeutics, along with other types of approaches. So a combination of therapeutics and changes in lifestyle. So with that being said, we do want to have diversity in our clinical trials. You know, I talked about how families need to understand that not every trial is about a drug, and that they do have options to participate in other kinds of trials, but it's important for them to participate in drug-related trials. Diversity in trials is vital. We must ensure that regardless of race, ethnicity, age, or gender, new Alzheimer's treatments are going to be effective and safe for everyone. So this resource, Trial Match, this is an Alzheimer's Association resource, and it actually connects those living with Alzheimer's disease or ADRD, caregivers, and even healthy volunteers. I am actually registered on Trial Match. This is a resource where you register to become connected and learn more about clinical trials, perhaps in your area, in your geographic area. It is as simple as you logging on, giving it your information. I think it asks for your name and email address, and then your city location, city and state. And once you give it that, you then tell the system what kind of trials you would be interested in. So are you interested in an Alzheimer's disease trial? Maybe you're interested in a vascular dementia trial. And then there is actually a box that even allows you to add a little extra. So you know what? I'm interested in Alzheimer's disease, but I'm also interested in a trial that's also focusing on arthritis, that has some, that's looking at other diseases as well. These numbers that you see here, those are actually the number of available trials for those diseases. So there are 641 currently Alzheimer's disease trials, 278 mild cognitive impairment trials, and 21 vascular dementia, and 88 other. This trial, this particular resource, these trials need to be viewed by an external board and get approval before they can actually be placed in trial match. So for those who may have some concern about safety, know that there is a vetting process that these trials go through. So this means individuals will only be enrolling in clinical trials from credible researchers. And you can access this particular resource at alz.org, trial match, /trial match. Now, this next slide I thought was so important to include in our research division and what they're doing. This is the Science Hub app. And as we look at finding creative and effective ways to get information into communities, I believe that this is one of the most impactful resources that we've created. So this Science Hub app works basically to help communities stay connected to consistent updates and research. So, if we came and gave you an education class, you're going to get that education class and then we're going to leave, and then maybe something else happens in the next couple of months, but how would you know? We'd have to keep coming back, and we will come back, but there may be time that lapses between one visit and the next. So this allows communities to stay connected to consistent updates. The Science Hub app is free, and it provides the latest news, information on Alzheimer's dementia research. I believe that learning is continual, and no one should be excluded from the opportunity to learn, particularly about health matters. What I love about this app is that it, for me, I believe, offers a small solution for individuals who may not have home computers, or in a rural community where there may not be a lot of resources. Perhaps we haven't gotten to your rural community yet to facilitate education programs. I believe that this is an incredible app, and it also provides information on global research. So it tells you what's going on around the globe. The outcomes of our efforts have really been quite impressive. First of all, the Alzheimer's Association continues to work on national and local levels to ensure care and support for all of those affected by Alzheimer's and other dementias, and is committed to accelerating the global effort to eliminate Alzheimer's and all other dementia. In 2022, we reached over 320,000 people. We served over 320,000 people through education programs, support groups, care consultations, and early stage engagement programs. We created 19 new DEI national partnerships to advance our efforts in reaching all communities. And I wanted to share that when I look, the registries, the current registries are in South Carolina, Georgia, and West Virginia. And I wanted to share that we have awarded 58 Alzheimer's Association research grants, totaling $9.4 million to those states. Our commitment to research is relentless. Our commitment to supporting families is relentless, but we know that it is important for us to support local efforts. We're doing our part, but you are in the community, and it's important for us to make sure that we are supporting those people who are trying to make a difference in their communities. So our vision is a world without Alzheimer's disease and all other dementia. And until that happens, until we are able to find a cure and achieve that, we are dedicated to supporting, serving, and advocating and advancing the science for all of those being impacted by ADRD. Thank you so much for your time this morning. I also wanted to say to everyone, to connect with your local Alzheimer's Association chapter, please visit alz.org And if you needed to reach out to me, if you have any questions, you can reach me at Greta J. Brown, at gjbrown@alz.org.
Fantastic. Thank you so much, Greta, for that chock-full presentation. It was so great to hear about the wide array of resources, say that 3 times fast, that are offered by the Alzheimer's Association. So there are a couple of questions, and we'll go ahead and take a couple and then start the break a little bit later than planned, but I think it's really great that we have some questions and interest here amongst our participants. So the first comment and question is about community champions and how powerful their impact can be. Really picking up on that story about your grandmother. How can we continue to collaborate with communities specifically to reduce stigma associated with cognitive decline? And for me, I think the most important parts of that question are the how, right? And then also reducing stigma.
Well, I think the first thing that we, excuse me, that we need to do, the how, is reach out. I think that we need to be, one of the things that we're having internal conversations about is the importance of being in community. When you are in community, you are able to connect with community members. And I'd like to remind people often, you don't have to connect with a whole lot of community members. Sometimes you can just connect with 1 or 2, and they are so well connected that they pull you in and connect you to hundreds. So I think that it's really important that we kind of step out of our offices and we step into communities. And in terms of reducing stigma, I think that, again, will go back to the importance of being in community and having conversation. One of the things that is noted on, the Alzheimer's Association just released its 2023 facts and figures. And one of the facts that's on that document is that heart-related deaths are actually declining. They've declined about a little over 7%. Alzheimer's related deaths have increased over 100%. This is just my thought. I think that some of that decline in heart-related deaths is because we are talking about heart health more. We are talking about the things that we need to do, exercising and drinking more water and eating healthy. So I think that if we can be in community and we can be talking about the disease, I think it's through that you remove the stigma from the disease. And by the way, the conversation about this being a disease, someone once asked me, why don't we talk about it? It's a disease, like cancer is a disease or heart disease, but someone is more likely to tell you that they have cancer than they are to tell you that they have some form of dementia.
Thank you, Greta. Any other comments or questions? Well, I'm gonna pick up on from my colleague, Maggie Miller. Great presentation, and your energy is definitely contagious. So we thank you again for accepting our invitation and providing us such a rich array of information that we can go back to. So now I'm going to head us into our break. Be sure to return at 10:45, at which time Dr. Daniela Friedman will be moderating a session with Ms. Rana Bayagli, Dr. Maggie Miller, and Dr. Bernie Schurz entitled Introduction to Statewide Alzheimer's Disease Registries. Thank you so much.